welcome all, and thank you so much for joining us at Geography 2050's Fall Symposium for Equitable Maps and Stronger Communities, the power of open mapping to level the healthcare playing field. We have a great panel ahead of us today, so you're here for talking about and hearing about how leading global humanitarian organizations leverage Openstreetmap and other open source mapping tools to ensure equitable representation of vulnerable populations on the world map and strengthen communities' access to quality healthcare. We're going to be talking through some tough topics today, looking at things like data equity, health equity, citizen-generated data. We have three fantastic panelists with us today. So introducing myself, I'm Tyler Radford. I'm Executive Director of Humanitarian Openstreetmap team. We also have with us Audrey Lessard, GIS Center Head of Services for MSF. We have Lamine Njai, OpenStreetMap Cartographic Consultant and founder of OpenStreetMap Senegal. And last but not least, Diego Gonzalez Ferrero, Data Lead and Unite Maps Product Manager at the UN Global Service Center in Brindisi, Italy. So we'll start today with hearing from each panelist for about 5 minutes. I'll begin telling you a little bit more about the open mapping movement and how all of our panelists today are involved in that movement through different avenues, representing NGOs, international organizations, and OpenStreetMap communities themselves. So let's jump into things. Great. Talking a little bit about the open mapping movement and humanitarian OpenStreetMap team. HOT is an international NGO dedicated to humanitarian action and community development through open mapping. Our vision of the world and what we're working towards is a world in which everyone is counted, map data is accessible and used in decisions that save and improve lives, and everyone can engage and contribute to the map. However, with that being said, we have some work to do to get there. We, according to analysis conducted by HOT, we believe that 1 billion people live in places that still, in 2021, are not very well mapped on the world's map in OpenStreetMap. And you can see those represented by the lighter shades of yellow on this map. So what's our vision and what we're working towards? Over the next 5 years, HOT is working to scale up support to the open mapping movement, supporting local mapping communities across 94 countries. Through this process, we're aiming to mobilize 1 million people and mapping an area home to 1 billion, adding critical data in places of high risk of disaster or places that are experiencing multidimensional poverty, and then supporting partners to use that data in ways that directly impact people's lives. So our panelists today, and we can go to the next slide, please. Our panelists today are going to be talking about a really challenging issue. So how to connect what we see on the left here, which is a mapper, somebody who's contributing data to the map, to actually delivering changes in people's lives. And the photo on the right is from one of our partners in Cusco, Peru, the GAL School, who's using maps and map data to inform and actually plan for things like oxygen delivery related to the COVID-19 pandemic. So this is the challenge we're going to be focusing on today. How can maps, how can open geospatial data contribute to more equitable health outcomes? And with that, we'll now hear a few minutes from each of our panelists, just a little bit about what each organization does and what each organization is contributing as part of the open mapping movement. So Audrey, happy to turn it over to you to hear a little bit about how this is working at MSF.
Thank you, Tyler. So perhaps we can move into the next slide already. So whom is Doctors Without Borders? So we're an international independent medical humanitarian organization with values of independence, neutrality, and impartiality. We go into places where others aren't going, and we try to provide health services to people not having access to them in different contexts. We have 65,000 employees over 70 different countries that are working with us today. And we're largely supported by private donors with both a vocation to speak out about what we're seeing in the different contexts where we are, on top of our primary mission of healthcare. Now, what is GIS at MSF? So GIS is there to support our operation by giving them access to maps and data visualization to better understand both the context of where we're working and also monitor our activities, in some cases even pilot some of our activities, and also use the maps to report and communicate on both on our activities and what's going on in the countries where we work. So use them also in terms of advocacy. Here I've shown on the map a fairly recent example during the Tigray crisis. So MSF was providing support in the camps that were on the Sudan side in terms of medical consultation. And our GIS specialist there was providing maps, both from data from open source data and also data collected directly in the field to provide detailed maps of the camp to help our decision makers to decide to better implement our response there. So next. So I also wanted to put a slide in terms of why do we need external and, of course, external and open data. So our teams are often deployed in the field for short mission in very remote regions, where still today, as Tyler pointed it out in his presentation, the data available is very scarce. We need to rely on both geospatial data and open community-based, non-sensitive geospatial data to be able to map the zones where we work for our teams. Because our goal as the GIS providers within MSF is to use different sources of external data and add on top of it the MSF operational data to really help our operation better navigate in the field and better understand the impact of their activities. So here you have an example of the cyclone Idai, where indeed the Openstreetmap teams, and different open source initiatives really mapped out the zone that was impacted by the cyclone. And then us on the MSF side, we imported those data, and on top of that data, we planned our WATSAN activities. For example, here on the map, you see the different data water sources points and whether they were functioning or non-functioning, and also the number of cases that we were seeing in terms of cholera, which was a big risk at that point during that crisis. So that's all I wanted to share with you as a start, just to set the scene.
Audrey, thanks so much, and it's really interesting to see the really practical example from Mozambique there. So thanks for sharing. Lamine, we're going to go to you to hear a little bit more about how this is working in Senegal.
Hello everyone, my name is Mohamed Lamine, and I'm one member of Openstreetmap Senegal, and I work with Mark and Healthsite since 2019 to involve all health infrastructure in Senegal at this platform. Okay. Openstreetmap Senegal is a community. It exists since 2012 with a mission of the humanitarian Openstreetmap team, and he is activated on digital mapping of territory in order to help decision making in localities for fight against disparity in terms of access to quality geographic data. We work in partnership with public, private, and non-governmental organizations and local authorities in order to help them in their effort to collect, update, and analyze data for efficient decision making for the population. The community composed mostly of students, but also of professionals who are passionate about mapping and share the vision of the Openstreetmap project. The activities of community are, among others, the advocacy to the authorities on the benefit of collaborative mapping Openstreetmap, training in the use of tools, the production of data at the platform, and the organization of Mapathon during activation in time of crisis. During COVID-19, we work with health site to involve all health emergency in Senegal. This health site is a strongly baseline health facility data with OpenStreetMap. And with Mark, we work since 2019 to this project. Accurate and opening baseline health facility data that live in OpenStreetMap. This work is to support collaborative between National Health Agency and volunteer communities and connect multi-data streams to build higher quality data, support human-centered design to drive the development of the data. And now you have some user story because the epidemic preparedness, accurate health care, and to support the immunization programs, health facilities planning, to support for disease response, maternity care, and support for social entrepreneurs. Donc, has a pregnant mom preparing for birth, he would like to visit facilities with an ultrasound, just so I can give my baby the best care possible. It is a user story for Maria. She is a mom and he need facilities health who have ultrasound. During COVID-19, we have a project with Mark, and the grant is from humanitarian Openstreetmap team during pandemics, and we work to mapping all emergency health service in Senegal. This project is leading by Health Site and Openstreetmap community and Kato ONG. The beginning of this project is a pilot phase at 2019 in Saint Louis, and he updating the emergency health service available. Okay, this is the first stage at this mission, and we have meeting with Dr. Njai, the head of medical region, to present the approach and obtain this approval to collect data and to update the database into Openstreetmap and health site. We have some statistic. You have 10 numerator mobilizing 10 numerator have mobilized by the community to collect 104 establishments in 3 days, and 41 private, 58 publics, and 3 community, 1 ONG and 1 communism. When cut upon all times, and also you have 24 not healthcare accessibility, and 4 in solar electricity. This is some visualization after this work are doing. Donc you have an bed statistic in before and after collect. Now, before this collect, you have some data in Sandy, but after the collect, you have many information for bed capacities on facilities health. And after in collaboration for with Heidelberg Institute, we have the isochrone to calculate the travel time estimated, giving a certain amount of travel, car, bicycle, and food. How long do we need to search a certain place? Because we are to place makeshift health facilities to effectively serves large number of people, and he helped population to have facility access at the at these facilities health. This is an animation, and this is the last of my presentation. You can just visualize the video, and thanks for your patience.
Whether we are dealing with global pandemics, local disease outbreaks, or day-to-day health needs, we need good data to make a difference. Health Sites is building a baseline of health facility data with Openstreetmap. Find out how you can participate. Maria needs an ultrasound scan. She needs to know where she can get one in her area. When MSF responds to a disaster, they need to know where to send their resources. Health Sites is a global initiative to build a baseline of health facility data with Openstreetmap. Health Sites facilitates contributions from volunteers from around the world to improve health facility data in hard-to-reach places. Local mappers, including nurses, doctors, and stakeholders in the health cluster, help us geolocate health facilities and list services available, all on Openstreetmap. The availability of this data enables humanitarian organizations and the medical community at large to build upon this information and help keep it up to date. Health Sites launched in support of the Ebola outbreak in 2014 and partners with leading organizations in the field to improve baseline health facility data. Data which helps these organizations prevent, predict, and respond to disease outbreaks. It also allows governments to update their often out-of-date health facility data, which in turn helps them with their health capacity planning. And it helps individuals access healthcare when they need it, saving time and lives in the process. Get involved. Become a mapper in your community. Share existing data or support Health Sites financially. Your donation will fund on-the-ground mappers that will get the job done, providing critical information where it is needed most.
Okay, great. Lamine, thank you so much. It's really interesting to see some of the specific use cases that you're thinking about in using Health Sites for in Senegal, so appreciate that. Okay, Diego, we're going to go to you to hear about the United Nations involvement in open mapping.
Okay, thank you very much, Tyler, and thank you to the organizers for having me. So I work at the United Nations Global Service Center, in which we provide support to several peacekeeping and political missions across the globe. And specifically in my case, we do provide support in terms of geospatial activities, tools, and services. Go ahead, please. Okay, so normally in the UN, we are constantly using location-based services. But unfortunately, we cannot use internally for our applications, we cannot use the commercial providers for several reasons. The first one is because there is a lack of data in the areas of interest where we are working on. Also, it's difficult to put together different data sources. And at the same time, and this is one of the most important reasons, we need, as you can imagine in the UN, we need to be very cautious in terms of diplomatic and political sensitivity, especially when it comes to international boundaries and spelling of towns and villages and capitals. That's why we need a system, an internal system, to put all those different data sources together and fetch the data either from the open source, like for example in Openstreetmap, or internally. Please. So luckily, this is what I will be presenting today. We have an alternative to the commercial providers. And as you can see here, we have created in my office different features or components. We call it Unite Maps. And as you can see here, we have from the different street level mapping to operational data. We identify daily activities carried out by the UN, or also different background maps, like for example, satellite imagery or different flavors of maps. And last but not least, also we are providing 3D view with terrain data. Please. The important thing about Unite Maps and these services that we are providing is that really is a foundational solution, a foundational system for several different UN applications that are used across the different organizations. And those applications are tackling different topics, from health, obviously, to environment, to human rights, to security, etc. But what we are doing here is to put the geospatial component and the geo-enablement of these applications to the core, to the center of those solutions. Please. And as I mentioned, this is called Unite Maps. And those are the different components that we are providing. 3 base maps, a street map, an image map, and a terrain map. We have a 3D solution as well. We do have operational data that is coming directly from our colleagues in the field related to their daily operations. And we also provide the direction and search functionality to know exactly the best way to go from point A to point B, and to find and discover the exact location of certain UN camps or specific points of interest that otherwise would not be available in the commercial providers. Last, there is one application that we've called Maps on Demand, in which we are providing a self-serving application to create and empower users to create their own maps. And you can be thinking, okay, how do you do all this with a small team based in the south of Italy, in Brindisi? Well, we obviously leverage open data, and we are fully immersed in Openstreetmap. But this is not enough. We are building up, establishing a community around Openstreetmap that we have called UN Mappers, in order to update and edit topographic data that it will be used across the different UN missions in support of the peace building and the humanitarian activities. Please. And this is just a couple of examples of areas, in this case is in Somalia. And basically what I want to show you here is that we are really bringing all these maps and data back to life, comparing in this case, the commercial providers with Openstreetmap data. Please, this is in Somalia, this is in Central African Republic, in Bambari. Please, this is in Nyoka, in the Democratic Republic of Congo. And we are, this is another one in Mali, around Kidal, in which you can see that we are working on building the land cover, land use, working on the roads, buildings, all the infrastructure, and everything, putting it to the community. Please. And the last one here is in South Sudan, around Renk, and it's basically the same thing. Really bringing together the community and the internal capability that we have at the UN to bring back to life all these areas with new data that is available for everyone, and specifically also for the UN components. Please. And as you can see here in this short video, we are making the data grow. We are at the moment supporting the mapping in 5 different missions in sub-Saharan Africa. We have created a grid, and we have already mapped more than 340 of those cells over the last 3 years. So the progress is really impressive. Go ahead. And these are just a few figures. In the UN Mappers community, we are bringing contributors. So far, more than 1,750 contributors. We have trained, we are doing training sessions for more than 190 people who've been helping us collecting data on OpenStreetMap. And as you can see on those graphs, we are working on adding new buildings, in this case, more than 140,000 buildings added over the last 3 years, 290,000 kilometers of roads, like going around the globe in 15 times, or 100,000 kilometers of rivers, so like 17 times the length of the River Nile, and 160,000 square kilometers of land cover and land use mapped, which is roughly the equivalent to half the country of Italy. Next. This is just the last slide. We want to showcase the work that we've done also with the community in OpenStreetMap, crowdsourcing data, specifically buildings in Mogadishu. In just a few weeks, calling for action to the different UN mappers, we collected data for 50,000 buildings, basically putting lots of families on the map. So the next one. So thank you very much. We want to say mapping the world, supporting peace and serving humanity in Unite Maps, and welcome to UN Mappers. Thank you very much.
Diego, thank you very much. And I'll say, as a former UN staff member as well, I'm really pleased and happy to see the UN working in the open in this way. And it really shows the power of the citizen contributors in what can be achieved through that. So appreciate that. Great. So now we'll move into some questions and answers for each of you. And Audrey, I think I'll start with you. Your organization is very directly delivering health services or enabling the delivery of health services. I'm curious if you could talk to us a little bit about the connection between maps and healthcare delivery. And maybe just tell us about a specific example you have, something that you've been most proud of in terms of supporting.
So one of the support that we're doing for really related to epidemic is, of course, mapping out how is the evolution of an epidemic, and we need good background data for it. So what we usually do is we work together in tandem with epidemiologists to have them provide the information about the number of people being sick, or even the number of so we call them the number of cases, the rate attacks, so different data related to the epidemic, and we relate them to the origin of the cases, where the patients are coming from. So it helps the epidemiologist getting an overview of where the epidemic started and how it's growing. I think we've all seen quite a few maps over the last couple of years related to COVID, but we're also doing that kind of maps for more local crises.
Audrey, thanks. Going back to the topic of our panel and the title of our panel today, we have the word equitable right next to the word maps. So I'm curious to hear everybody's take on that. We often, I think the general public often sees maps and thinks maps are not telling a story. They're displaying a set of facts or a set of realities. And sometimes that's not always the case. Diego, maybe I'll start with you to just get your take on that. What is the connection between maps and equity, and how can a map be equitable or not equitable?
I think the access to geospatial data and maps in general it should be like a basic right, because as you said, is providing facts, and if we are not putting people on the maps, they are out of the picture, out of the planning process, and out of the development of their activities. Specifically, what we are trying to do with Unite Maps and the UN Mappers community is to bring those data and those maps back to the local communities. We are trying to engage with our counterparts and our colleagues in the UN in the different field missions, and with the local communities. And this is something key to bring them on board and to engage, so that they can build up their own maps, their own data, to make data fair, not only for the developed communities, but also for the developing countries.
Representativeness and making data fair. Thanks, Diego. Audrey, I want to go to you next. What does equitable and maps mean to you, or what is an equitable map?
No, I think I really go in the same line as Diego, meaning that we're trying to reach the population that are left out and that do not have access to healthcare. So not having them on the map makes it sometimes really difficult to reach out to them. And I'm thinking specifically, for example, one of the late Ebola crises, not the major one in Eastern Congo that lasted for 2 years, but just before that, there was a smaller outbreak in the Equator region. And we knew that the cases were coming from small villages hidden in the forest. And so our teams had to go into motorbike and even walking to find those villages. And so having the maps really helped them to make sure that we weren't forgetting about anyone.
Audrey, thanks. Lamine, can you tell us a little bit about how this is working in Senegal? Maybe give us an example of how you're seeing maps actually being used to address health disparities. Lamine, can you check your microphone?
Okay, thank you, Tyler, for your questions. And I said before COVID-19, to show the limit that state structure with our developing country have without the support of the mapping community to effectively meet the needs in terms of quality geographic data in record times, to alleviate the to contain the population in terms of reliable and timely information on the extent of the territory, but also that to show that the population themselves have deficit of information on the provision of services at the level of health structure. With the community mapping, our politics authorities have been able to register the need according to the demand at the shortcoming observed, but I turn has considerably increased the quality of services in health structure.
Great, Lamine, thank you for that. I want to talk a little bit about the current COVID pandemic and the connection to maps, and all of you touched on this a little bit. And Lamine, you've been doing some work in Senegal around the COVID pandemic. I wanted to go to actually a quote from Bill Gates ahead of the UN General Assembly last month. He was referring to the fact that through the first half of 2021, only 1% of COVID vaccines have been administered in low-income countries. His quote was that we face the very real risk that in the future, wealthy countries and communities will begin treating COVID-19 as yet another disease of poverty. We can't put the pandemic behind us until everyone, regardless of where they live, has access to vaccines. I'm going to go, Lamine, do you want to comment first, and then I'll go to you, Audrey, on what is the connection between MAPS and immunizations, or MAPS and vaccinations?
Okay. I give the example of the work we're doing to the emergency operator center. Since COVID-19, we work to involve all facilities in Openstreetmap health, and the work helped very well authorities and Ministry of Health to prepare the campaign of vaccination and to orient all people about the emplacement of health facilities, and everybody can go to take vaccination at this center.
Lamine, thanks. Audrey.
You've asked a very wide question there. So I would say we've been for long also under the logistic department here. So having a vaccination campaign is a huge logistic to put everything into place, to make sure that the vaccine reach at the right place, that they remain cold to the whole way through, and that you have your vaccination sites being close enough to the people that you do want to reach out to. And when you want to do a countrywide vaccination campaign, the implications are huge. I mean, even in high-level countries, it took quite a while for the countries to get them running. So I guess having really, and I think we have not been involved directly into them, but I think there's been a really nice initiative cross-organization to support on the mapping side to give this, to help the Ministry of Health and different organizations to organize and set up vaccination campaigns and help out on the logistics of it.
Audrey, thanks. Indeed, yeah, up until now, I think we've been facing really heavy supply issues in terms of vaccines, and going forward, my sense is we're just kind of at that precipice of actually using data to inform logistics and inform delivery, but I'm hopeful we're getting there. Diego, I wanted to go to you. In terms of the UN peacekeeping missions, can you tell us anything you're personally excited about in terms of how the missions, maybe any example from one of the missions that you're supporting, actually using map data to inform mission operations, if there's anything related to provision of healthcare or civil affairs? I'd be curious to hear kind of what the emerging use cases might be.
Yeah. Among the different field missions that we are supporting, maybe I can take the example of MINUSCA, which is the peacekeeping mission in Central African Republic. As you know, specifically in my organization, we are not directly supporting the provision of health. But actually we are doing it indirectly by providing data and maps to our different counterparts. And this has been a game changer. In the past, there was such a lack of data that we were not able to provide reasonable, for example, driving times to remote locations, or accessibility to specific areas. Now with new data, with raw data that we have ingested into Openstreetmap, we are able to confidently provide these geospatial services to our counterparts in the missions. So for us, it's been really a change in the culture and the paradigm, and we are now able to use those maps and those data for logistics, for supply chain, for different activities related to human rights and civil affairs. And all the different mission components are really eager to contribute to the update and enhancement of the data, so that we can expand those maps in specific areas where the UN has its operations.
Diego, you were very personally involved in kind of making the switch within the UN to thinking more openly and working with citizen contributors. Can you tell us a little bit more about how that process happened? What helped you to make the decision to go open?
Yeah, it was about 4 or 5 years ago. It was a group of colleagues that we were thinking how to provide better support in terms of geospatial services to our clients in the field missions. In the past, what we were doing was collecting the data locally with a specific data structure that unfortunately was never updated. And it was only used for a very specific output, which was a 50K, 1:50,000 scale topographic map. And that was it. It was static data. So we had used in the past Openstreetmap, but in a static format. And we really decided to make the shift, the change, embrace the open data, and specifically Openstreetmap, to do all the edits on Openstreetmap, and at the same time to be able to capture and bring the data locally to our databases on a daily basis, so that we use that data for several different applications and outputs. That's really the change that we have implemented across the different missions, going from a specific data structure to being able to use it for multiple activities and outputs, and it's working.
Yeah, thanks, Diego. Lamine, you were very personally involved in founding Openstreetmap Senegal. Can you tell me more about your interest in open data and working in open mapping?
Okay, thanks, Tyler. And in Openstreetmap Senegal, we use the tools of Openstreetmap ecosystems, among others, the availability at the platform allowing to centralize all data using an open database, and also the software resource and platform are not paying, which allow to relocate resource in terms of pushes at the ladder to other budget line. As a community of collaborative mappers, OpenStreetMap has satisfied by the vision of the OpenStreetMap project, and we provide a sustainable response on the problem of geographic data protection and equitable access to this data.
I mean, thank you. Audrey, same question to you. Why did MSF decide to work in the open?
In open data. So we're doing a mix, really. We're doing a bit of both, because some of our data and also in some of the zones where we're working, we consider they're too sensitive to share back, but we're really trying to share back as much as possible the data that we collect and source from Openstreetmap, namely, because as I said in my introduction, so MSF, we're going very specifically in some zone of a country, in a smaller zone of a country, not countrywide, very generic map, but we want the very details of what's going on in the field to support our operation and our daily activities there. So we need precise maps, and we're not able to maintain that by ourselves. And it also really makes sense that this data is available to everyone living in that region and or working in that region. So for both aspects, for us, it's really a plus to go towards more open data.
Audrey, thanks. This is a question to anyone who would like to take it, but we talked a lot about equity in terms of the map itself and how we want the resulting map to be more equitable. What about the process of creating maps? Is there equity involved in that process of who's making the map and who's creating the map? Would anyone like to take that?
I think it's a difficult question. I think the most important thing is, first of all, to make the data available. The data is the foundation of those maps and those outputs. If we make the data available, we will be able to provide the different outputs and maps. At the same time, what we are doing within our organization is to, as I mentioned briefly during the introduction, we are trying to empower non-GIS or geographers, non-GIS specialists to produce and to create their own maps. I think there are different UN organizations that are providing maps out of not only Openstreetmap, but also specific data that is being collected by them. And making available the possibility to create those maps empowers those communities and those people for example, in developing countries where we work. So that's extremely important, how to also create those outputs so that they can factor them in and they can create their own analysis and they can act and plan accordingly.
Audrey or Lamine, if you'd like to address that, feel free. I have one closing question for all of you in kind of looking towards the future. How do you see this process changing in the future? What innovative approaches do you think your organization might take to actually address health disparities using open geographic data or methods? Or how would you like other organizations to support this or become more involved?
Okay.
Go ahead, Lamine.
Okay, Audrey, for you.
Okay, so good questions toward the end, really. So how will we see the future towards this? I think a few years back when I started working on this, back then I was quite small with MSF, we were looking for data, just having some data for the zones that we were working, and we were amazed when that Ebola crisis in 2014 started, and within a few days, hours, we managed to map out the first few towns where it was happening, and it really helped out. And now we're really looking, and I think in the future we'll be looking more into that and to improve, making sure that we have quality in that data, and that's something that we still struggle with today. Because we need to be reliable in terms of the data that we provide to our team, mostly focusing, I would say, on the health related data. So where are our health facilities, where also what's the catchment area for health centers and such data. And in the future, I think we don't have the answer, and we're looking into other organizations to help us with the answers for that. But definitely making sure that we have this quality in terms of the data to make our response more to optimize our response as well.
Audrey, thanks. Lamine, what do you see as the future of Openstreetmap and health sites and providing equitable healthcare in Senegal?
Okay, now we work to involve all facilities, and the next step of this work is to use all data to give access to the population to services, quality services, and he help authorities to make a good decision for public politics. And yeah, we are here to involve all member of community to doing this work to product data and to update all the data we need in my country and around the world.
Lamine, thank you very much. Diego, you have the last word. What's next for the UN in regards to open mapping?
Bringing more partners together. I think at the different levels. Our vision is to expand the activities about Openstreetmap geographically to other different field missions, but also within the existing field missions that we are supporting, to bring more partners, more people together, different organizations, and the different UN entities as well, and always engaging with the local community. This is a key factor, because at the end of the day, we are working and providing data for a specific area, and the people living there should have a prominent voice in the way that we are collecting and gathering the information. Another point would be maybe combine the human factor, which will be at the core of Openstreetmap, and making it easy with new technology and artificial intelligence. So to be able to provide that capability to increase the speed of edits, combining different data, and at the same time supporting what Audrey mentioned about the quality of the data. It's extremely important that we are confident enough that we are sustaining the data and giving it a consistency through editing guidelines, tags, etc. Thanks.
Diego, Lamine, Audrey, thank you very much. This has been Equitable Maps and Stronger Communities. And to all our participants, thanks for joining us, and we hope you enjoy the rest of the symposium.
Thank you.
Thank you very much. Thank you, Taylor.